Thanks, Becca. Again, we would like to welcome everyone. Thank you so much for joining us. I'm KDC. I'm the Brownfields Redevelopment Specialist here at WVU. And so today's topic is what we like to call a hot topic. It has to do with public health. And so the title of our presentation today is Which Public Health Issues Plague Your Town? So this is the first in a two-part series that we hope will be beneficial to you if you're looking to apply for an EPA assessment grant. And we have a wonderful guest speaker here for you. So moving on to the next slide, please. So just a little bit about why we here at West Virginia University are hosting this throughout the Mid-Atlantic region. We are the technical assistance to brownfield provider for EPA Region 3. And so that part of what we do is education and outreach. And so that's why we are hosting this today. So again, we have Christiaan Abildso, and he's going to be running the show, and it's going to be a fabulous presentation. But before we kick it off, it would be really helpful for us if you could take this quick poll. It helps us gauge what you know already, and then hopefully what you will learn from the webinar. So if you could just take a few moments. The first one is, before today, have you ever used these online data tools? And you can check all that apply. The second question is, how confident are you that you can find the asthma, cancer, or birth defects data for the census tract where a brownfield site exists? And the third question, are you aware of the connection between brownfield sites and health impacts? Again, we appreciate your time.
All right, a lot of folks are answering. Appreciate that. I'll let you keep going. I look a lot cooler in this picture than I normally do every day, but my name is Christiaan. I'm a faculty member in the School of Public Health here at WVU, and do a lot of research in this area. And as you can see, a lot of practice what I preach and what I research by getting out and enjoying the built environment and the unbuilt environment out in the woods. So looks like, how many more folks? Maybe a couple more are going to answer, and I'm looking at seeing what sites folks have used before. A couple have used county health rankings, and we got one each in the CDC places and city health data. Okay. I'll give it another 15 seconds. This is where the Jeopardy music is supposed to kick in. All right. Okay, I'm going to move the poll out of my way, Paige, if you want to maybe get another 10 seconds and shut it down, that'd be cool. All right. So that is helpful information to let me know how many folks have been involved in looking through health data. It can be a little bit intimidating, but as I talk today, I also want you all, if you're working in the brownfield space, thinking about a specific place or a specific site, you know, we're going to talk through the reasons you need health data for your applications, but also do, as we look at different places to get health data, do a little quiz and help you find your local data and help you apply kind of what I'm talking through. So there'll be a little bit of me talking at you for a bit, but then hopefully you'll have time. I'll definitely leave some time at the end for you all to look at your local health, look at your local data and find information that could help you with your grant application. So you can see there the overview of the day. I talked a little bit about that and the objectives. And ideally, what our goal is to help you with your brownfield grant applications and assessment grant specifically. So that's what we'll look at today. Sort of the broad overview. I'm just going to move something out of the way here. Community concerns, individuals every day around your communities, and you all as well, if you're working in this space, that the brownfields issues often center on a public health issue. And really, and the research I do is in the built environment and how we can take these kind of dilapidated, unsafe, unfriendly, inaccessible places and turn them, these liabilities, into assets in communities and rural places, specifically in smaller towns in my work. And you can see the link in the chain. Oftentimes, Carrie and others with the WVU tab will show this. But at the end of the day, after all this disinvestment over time, seeing a building turn into a safety risk and a drag on the economy and drag on quality of life, it can lead to adverse health conditions. And many that we talk about here are linked with air and water quality, soil quality, and stuff like that. But I'll talk about, over time, many of these things, when you think about unsafe conditions, they are not conducive to getting out, being physically active, growing healthy foods and things like that, which also are a step in the chain to, leading to chronic health conditions like diabetes, heart disease, also cancers, and many things that can build up that are really plaguing a lot of areas where there's been disinvestment over generations. So that's kind of where I'm approaching it from. And so, one thing I want to draw your attention to give you an example of why I'm very interested in this and the work that a bunch of colleagues and I have been doing is some work that we published a couple of years ago. Gets kind of wonky qualitative stuff, but looking at areas, rural communities and rural counties that actually do a very good job, have high rates of physical activity, even though many counties in rural America don't. We often talk about the negative stuff in rural places, but there's some, that are doing very well in it. So we sought to, go out and learn from those. And for those that are familiar with the community capitals framework, we didn't seek to frame it this way or to show it this way, but when we talked to people as we went around these towns, comparing a couple counties that are very active versus one that is not, in a very rural state, not in West Virginia, I'll tell you that much. The rural counties with higher rates of activity were primarily, we're kind of constrained, first of all, by the natural environment. A place that has mountains and ski resorts is going to be different than those with oceans and the flatlands and things like that. So you see that we sort of started with this natural environment, in this cycle of what leads to physically active places. And that really influences the culture and the attitudes around physical activity, the attitudes around skiing versus the attitude of swimming in lakes and things like that. And surfing, the culture of surfing versus the culture of skiing based on what's available in the natural environment, for example. And we saw that when we started asking people more and more, we saw that really had an influence on the human capital. So the people in these communities, first of all, by individuals, whether they engage in physical activity or not, right? And then also whether they use their knowledge and skill and ability and where they work in organizations to encourage physical activity. So you see in the orange, you see how the culture and human organizational capital cycle together. And organizationally, those individuals will influence the policies and programs that go on. And therefore, when we start talking across organizations, it's this social capital and these physical activity focused collaborations, like the school teacher works with the extension agent who works with the economic development agent or economic development person to build a park or something. So you can see how those come together into the space we're talking about today, and what financing is available, and whether it's invested in physical activity spaces or not, and programs. And if it's invested in those physical activity spaces, that's built environment change. And for many folks, like I've been doing, that work in rural and small town physical activity and thinking things in this way, many of these places had so much disinvestment, and as we saw in the previous slide, that kind of negative built environment, that over time that can build up and decrease physical activity. But we're talking about the brownfields, redevelopment, and how that can improve the built environment, which leads to more physical activity, in the work that I looked at. And that kind of starts the cycle again and influences the culture and the human, capital, and makes people healthier, right? If people are more active, which further strengthens human capital to work on these things. So that's a little bit wonky. I understand it, but that's kind of where I'm operating from in a lot of my physical activity work in rural and small town America. Okay, so now, I think y'all are here today, so you need health data for certain things, right? So, but this is just to reinforce that the grants, when you're writing your grants, EPA wants to know many things, including the health needs of your target area. So you got to get some data on that. They also want to know how the grant will reduce those health burdens or improve the health, profile of your community, among many other things. And in talking with Katie and Carrie and Becca and Paige and everybody working in the brownfield space, this is kind of a newer area, and possibly one, going and finding this information could be intimidating for some folks. So I thought I'd try to break it down a little bit and focus on why you need it and what spaces. So thinking specifically about assessment grants, community health assessment is one of the planning activities that funding could be used for. I will talk more about community health assessments and other things in part 2 of this series, so hopefully you'll join me for that one. But the EPA is focused on protecting health and public health through brownfields redevelopment. So a great aspect of the brownfields redevelopment. Okay. So thinking more specifically about the actual grant application and the scoring criteria, you can see it broken down here. And point 4 on the far right is something I'll talk about more, again, in the next part of this series, the degree to which local health agency is involved. And I've done a bunch of work in that area. But today we're going to talk a bit about this section, section 2, where 40 points are assessed, the community need and community engagement aspect. And even more specifically, in the scoring criteria, looking through the call for applications, you'll see that every point matters in a grant application, right? So you see that 5 points are specifically dedicated to finding areas that have higher or greater than normal incidence of diseases or conditions. And in this case, they specifically cite cancer, asthma, or birth defects that may be associated with exposure to hazardous substances, pollutants, contaminants, or petroleum, okay? And you'll see if they do not suffer from greater than normal incidents, you only get 2 points. So there are other areas that are adjacent to what we're looking at. Obviously the health or welfare of sensitive populations, I'll talk about that a little bit. And then the environmental justice tools are ones I won't get into today, but was it the EJ index or others that can help you with that information. So hopefully, if you've looked at the grant application, you understand why you need it, but just wanted to reinforce it. And I just want to make sure we're looking good on time. Okay, so now I'm going to run through 3 different online data sources that are available to you. And then the strengths, the pros and cons of each. And at the end, we'll work on one at the city level. Okay, and again, hopefully you're thinking of a specific place. Okay, the first one, I saw a couple of people have worked with county health ranking data before. This is coming out of the University of Wisconsin. And they do a very good job at summarizing a bunch of different measures into a score or a comparison tool, so you can see how you stack up, your county stacks up against others in your state and other peer counties. So here's a drawing, here's an image of the model and all the different measures. So I'm going to take the big risk of going out and sharing. I'm going to go and take a look at the actual site. So here we go. We're going to share the new screen. Okay, Becca or Katie or Paige, give me a thumbs up if you see.
Looks great. County health model.
We are there. Awesome. So here's the model. Pretty good. It's a very visually appealing site. You can see essentially they rank counties based on some health outcomes. And you see, if you scroll over them, they pop up, and also health factors. And again, this is county level, may not be as useful to you, so I won't spend too much time on it. But I think relevant to the work you all are doing, you can see there are measures of air and water quality, like particulate matter. Some housing measures. Some folks are interested in broadband access, severe housing cost burden, things like that, to look at vulnerable populations. For me, also measures of the environment that I believe brownfields can influence are these diet and exercise measures of access, really, the Food Environment Index, as well as, so it's access to healthy foods, really, you can see that down here as well, and then also access to exercise opportunities. So again, this just gives you a summary. There's a black box of calculations that go on to give you a comparison of counties. So just a quick look at how to use this if you haven't, and I encourage you to take a look. If you click on Explore Health Rankings, it'll take you out, ideally. Here we go. Okay. And the easiest thing to do is look at location by county. And I'm going to look at Pendleton County, West Virginia, home of Seneca Rock and all kinds of good stuff. And once you look it up, as you can see, it gives a ranking based on the other counties in the state. Okay, that is not necessarily going to be as helpful to you in your applications. A couple things I want to point out, which are really helpful if you ever have the need to look at county data. You can see the county snapshot shows a bunch of it shows all the different measures. A couple things I want to highlight. First, if you want to just get right down to the meat of it and show places where the county is doing well relative to the state, as well as the higher performing counties in the United States, you can click this box of show areas of strength. And it'll highlight in purple the areas of strength, the areas where the county is doing well compared to the state and to the United States. And you see Pendleton County, maybe because of Seneca Rocks and the other Spruce Knob and other areas there, access to exercise opportunities is higher than expected, or higher than other areas. Now, if you want to get wonky and look at the full details of each measure, you click on the measure and you get access to what it means, and you can click out and look at greater depth at what people live close to a park or recreation facility really means. Okay, so you can get into the specifics of the measure that way. Okay, and you can see the Food Environment Index, excuse me, the one of interest to me as well, and an area of impact for brownfields, improving access to healthy foods. Pendleton County, this measure is scored from 0, lowest, to 10, the highest. It's a 6.6, same as West Virginia, lower than the United States. So the other thing you can do, not only show areas of strength, but you can show areas to explore where the county is doing a little worse than others. And you can see obesity stands out, smoking, and others. You can also see, and sorry for the scrolling, going down to this air pollution measure sticks out as an area of strength. You can see this trend line measure here, it's showing green, which means it's improving over time. If you click on that, you can see how exposure to particulate matter is changing over time. So again, those are some pros to this area, to this site. One last one, if you ever need to, and a really interesting tool, you can scroll down to this big blue box. It says compare this county to other counties. Okay, you can compare to nearby counties or peer counties based on demographic factors. So the way to do this, if you go to the add location plus sign, and I've already done this, and I know the peer counties only includes one from this region, and that is Bath County, Virginia. So if you add it in here, you can compare the two counties, and you can see Bath County also is very high as far as access to exercise opportunities, and the food environment index is better than Pendleton County, and maybe that has an effect on something like obesity, right? Pendleton County is far higher than Bath County. Okay, so again, ways to I encourage you to mess around with this site if you're ever working at the county level. Okay, now I'm going to go back to the slides real quick, and you'll see again listed here are some of the pros that I went over. County level data, a lot of different measures at the county level, good for comparison, highlighting areas of strength and areas of need of improvement. What it does not do, some of the big cons, why it probably won't be useful to you, but it's good to have in your kit to use. It does not have sub-county data, so you can't get down to a city or a census tract. It doesn't have any of the measures that are called out in the assessment grant application, asthma, cancer, or birth defects data. Okay, taking a quick breath. Next one up. City health data dashboard. I saw at least one person that was in here has used this one before. Comes out of NYU, really a very good dashboard, very user-friendly interface, and produces some nice maps. One of the big cons, though, as you'll see, excuse me, is that it only has data available for just over 900 cities, including all of those with a population over 50,000, and then a few other. And you can see the map of all those different cities. I mean, West Virginia is nearly blank. It has Charleston, essentially. And so if you're working in smaller areas, rural counties, you're not going to have much luck through here. But I do want to show you that if you are working in a larger area, you do have access to a bunch of very useful measures. And I'll show you those here, including breast cancer and colorectal cancer deaths. So that's mortality, not prevalence or incidence, like the grant application requests. But it does have access also to a number of measures where you could identify vulnerable populations, as well as some of these other air pollution, lead exposure, walkability, park access, access to healthy foods, which are also, again, in the brownfields impact space. So I'm going to go back up, click out on this one, and run through this fairly quickly as well, and show you how interesting it can be and what it can be used for. So if I'm thinking about Pendleton County, West Virginia, the county seat is Franklin. I know this because my son is doing all 55 counties and county seats in 8th grade. But as you can see, Franklin, the town, is not available. Franklin, West Virginia is not available. So that's one of the downfalls. So I'm going to look at Morgantown real quick. And hopefully folks are seeing this. It takes a minute to load up. Once you get the location entered, you do have access to many of the different health outcomes like I showed on the slide. Okay. One thing to look at, these metrics of breast cancer deaths and colorectal cancer deaths are not at the census tract level. And if we look at it, you can see here, it's not even available. Colorectal cancer death data are not even available for a smaller town like Morgantown, even though Morgantown does have some data in here. Okay, so that is not available. So what you can do is change metric. It'll take you back out here. So we'll look at some, one of the cool tools that you can do here is identify kind of vulnerable population and an outcome that's likely linked to it, and brownfield. So one thing we can look at is lead exposure risk. Okay, and you can see here, if we look at the number, actually Morgantown, the overall lead exposure risk of 10 is higher than the 5.5 average for all the cities that are included in this data set. Really interesting thing is you can look by census tract in Morgantown. So along the river, some of the older buildings, where the railroad was, you can see that the measure is higher. The darker blue is a higher measure, okay? Higher lead exposure risk. Okay, and you can see it's available at all the census tract levels. Okay, we can also use this to compare metrics. If you see up along the many arrows up here that just disappeared, you can compare metrics. Okay, so we'll do that. We look at lead exposure risk. You can pick the years. We'll stay with 2020. And then you can select a second one that's likely linked to it. And we will talk about we'll look at children in poverty. Okay, so what that will do then is load both measures into a single map, which shows higher risk in darker blue for lead exposure risk and higher rates of children in poverty in darker red. And where those two overlap are the really high risk areas, right? They're where the two measures overlap. And if you click on the census tract, you see high exposure risk, nearly 100% of the children living in poverty. Okay, that could be thrown off because Morgantown has a lot of students, lower income graduate students, whatever. So, but those data do exist for the larger cities and Morgantown, okay? All right. So that is one of the tools, one of the useful tools in this data set. Okay, so we are at 12:30, just keeping an eye on time. I think we're doing okay. We'll still have time to play. So now I'm going to go back to the slides. Again, a summary. We went through the pros of this. I showed some of the useful things, the metric comparison, cancer mortality it has. Again, that is related to many different things, not just the rate of cancer, but also access to healthcare and things like that for treatment. Okay, we saw the mapping. It doesn't have asthma or birth defect data, okay, again, which are called for in the grant application. And it only includes the data for certain size cities. And as you saw, some of the measures are at city level only, some at the census tract level, okay. But again, a good one for larger cities. All right, so here's the one to tune into because this is the one you'll be playing with. The other two websites, again, are limited in their geographic scope as far as census tract stuff, right? But they have pretty useful useful interfaces, okay? And you'll see in the chat the links to get there. Thank you for doing that. I forgot to look at the chat. Thanks, Becca. But you can see the CDC Places database. It has data using some pretty sophisticated estimation techniques and modeling for the smaller areas, but it has data across the entire United States for all census tracts, and it has for the zip code tabulation areas. So we'll take a look at the different measures and a couple things you notice as we look at the health outcomes measures that are provided in the map, that it does have asthma prevalence, which is called for in the application, and it has a summary measure of the prevalence of cancers, excluding skin cancers. Okay, so two measures that you need for your application. Okay, so I'm going to click out and go to the map. As long as everything works out. Hold on. There we go. Okay, let me do a new share. Okay. So hopefully everything is working here. Just stop me if you're not seeing the Places website, but I'm going to call your attention to this now and again later, but for those that are data heads, data wonks, and people that like to use GIS data, there are a good number of data sets available that you can use to do your own mapping, because this interface is not as friendly and not as easy to use as others. So I'm going to click on the interactive map. It's loading up, okay? All right, and it even warns you, maps may load slowly, especially your first time. Okay, So quick orientation to this one, because the place that you'll be focused on the most is this health outcomes tab that is shown here, and all the different outcomes, including, as you see, asthma and cancer. There are a number of other measures, like prevention measures, health risk behaviors like smoking, drinking, and inactivity, and low sleep, sleep prevalence, less than 7 hours, some summary measures of health status. I'm going to click on that, show physical and mental health measures. So it does have a good number of measures from multiple national data sets. And again, I encourage you to play with this and look at the actual measures. So I'm going back to the health outcomes. And as it loads, I'm going to look at cancer. Okay. All right, we're loading up. Okay, move this. Okay. So quick orientation. To look up a place, you go to the magnifying glass here on the top right. And this does get wonky. So I'm going to look up, yes, Franklin. So now we can go to Franklin, West Virginia. Okay, and you see in here, in Pendleton County. And it takes us there. Okay. One quick thing to note, you can, let me click on this again. If this window might keep getting in your way, you can dock it over to the right and then hide the search bar, okay? So you see, what we've clicked on here is actually this large census tract in Pendleton County, okay? So this is where it's not as friendly to use, but I want you to pay attention to this. This gives you the information on the right in the window here. And it tells you the estimated prevalence of cancer, excluding skin cancer, was 8.8%. Okay, in this area that is highlighted. Okay, and you see here, pay attention to this part where it says 1 of 2, because there's another tab here that also has information. So you see that. So I'm going to click on Franklin itself. And to do that, you'll generally have to click on one of these circles. And this is where, again, it's not as friendly. So I clicked on Franklin, and you see now there are 3 windows to look at. Okay, first it goes to the larger census tract in the county, kind of the middle of Pendleton County. Again, shows you that same data, 8.8% prevalence of cancer, and 3,775 people in that area. And if you go to the next window here, it shows you the city, the place, and census place of Franklin itself with the number, census, the tract number, right? Sorry, the place number, excuse me, there's the tract number. And then in Franklin is the place number. What it does at these sort of tighter areas, it shows you the overall prevalence rate of 11%. I'm highlighting it here, of cancer. So 11% is higher than this broader census tract, which was 8.8%. So that's the crude rate, so overall. Now, they also provide an age-adjusted prevalence rate, which really means they take the age profile and kind of shut off the effect of, in West Virginia especially, having an older population that's more likely to have higher rates of cancer. So it normalizes it to the full United States kind of age breakdown. So that can be compared to the United States data. So age-adjusted prevalence was only 6.1%, but the crude prevalence, the actual rate of what's going on in this area, 11%. You see the census place of Franklin and the number, 721 people, 11% cancer prevalence. Okay. So hopefully that shows. Now, if you go to a larger place, so I'm going to click out and go to a larger city with multiple census tracts like Morgantown, and we're still highlighted cancer. as you're using this, you can see when you click on the circle itself to get to a census tract, it will highlight that census tract. So this is, again, where you have to be careful. It shows you what's highlighted. 4 different tabs here that you can look at. It's also the next census tract over there, which I was clicking near. Then it will show Morgantown itself as the full city data, so 29,461 people, and the cancer rates and age-adjusted cancer rates. And then it'll highlight the whole city, okay? So again, as you scroll through these, just have to be careful about what you're selecting and what is showing up, okay? So there's another example. Click on a different census tract where it only shows the census tract information. But if you click on these little circles, like hopefully you see my mouse, it'll bring you to city level data as well. Okay. All right. So now I'm gonna get out of there, get back to the slides, and again, reinforce some of the pros and cons of CDC places, and the one that you are going to use now to look up your own location of interest. So this is probably the most useful data set or website for you because it has data from all over the United States. You can zoom in to the local level, has asthma and cancer prevalence, so the current percentage of people with asthma and cancer. Birth defects data, we hunted at best a local entity or like a hospital, or maybe your state bureau of public health might have it. But the surveillance of that, the national data, there's nothing consistently done across the United States for birth defects data. So you might be able to find that locally, but asthma and cancer are definitely available. The other thing Places does not allow, obviously it's not as user-friendly to do the mapping, but you can download the data and play with it if you have that capability. And it lacks the kind of cross-measure comparison. So that's one place where you might need to map kind of your vulnerable population somewhere else in a different way. Okay, now it's time for your homework. Everybody awake? Sorry about that. I hate talking at people on Zoom, but we're going to take about 5 or 10 minutes here. And your mission, if you choose to accept it, is to, and I think it's in the chat. Let me make sure the places link. Yes, Becca put it in the chat. So cdc.gov/places. Your challenge is to go to an area where you have a brownfield, where you're thinking, might be an area for redevelopment, and enter in the chat. So go to CDC Places, find that place, and enter in the chat the name of the city and the census tract, or the city place number that you looked up, and the asthma rate. So go into city places, look for the asthma rate at the tract that you're thinking of, where a brownfield is, and enter that information, the name of the city, census tract, or the place number, and the asthma rate. I'll give you some time to do that. Feel free to put any questions in the chat, and when you're done, give it about 5 minutes, I think, and then we'll kind of talk through your experience, see where you might need help. Like Katie knew the homework assignment coming in, so she's already looked one up. She advanced warning. And page 2.
I accepted the mission.
You knew what was coming. Got some from Kanawha County, Point Marion. Fairmont. Yeah, Fairmont, that one. Kalamazoo, Michigan. All right. Fun places to go to. 11.2%. Rochester, thanks, Laura. 9.8. Romney, 11.9. Fairmont has the highest one so far. Can we beat it? All right. All right. So how about this? I'm going to, if people are willing to speak, I'm going to stop sharing. And for those that found or didn't find the information, what's your feedback? Talk about how it was or what you did to get there if you had to create a little secret shortcut for yourself. And this is where I might call on someone. How about Zane? You found Fairmont's information. Was it easy or hard? What suggestions do you have?
I think it was easy enough. Really, I don't think I have a lot of feedback. I'm sorry.
That's all right.
I am confused by so it says in this area estimated prevalence percentage is 14.3 with 95% CI. What
Okay.
is that part?
Yeah, thanks, Zane. That's one thing. So that's essentially how confident they are, like how it's a measure of how close their estimate is. So they are 95% confident that the number is, what is it, 14.3 and within whatever range they put. Does that make sense? So do you have that's a confidence interval. That's what CI stands for.
Are other folks CI rates close to 95 also, or?
No. So they are, they're saying they are 95% confident it falls within whatever range they put up there. Do you have the one for yours, the range?
Yeah, 13.7 to 15.
Okay, yeah. So that's actually a pretty tight, that shows essentially how good they are with their estimate. The smaller, the tighter the confidence interval, the better. Does that make sense?
Yeah. Thank you.
It's fancy statistical stuff. Okay, Macy, you want to, let's see, you said, yeah, Macy, what, if you don't mind me asking, what areas, Macy posted she wants to see more data on essentially larger cities and asthma in specific areas of the city where there are big industrial facilities. Any specific area, Macy?
Hi, sorry, I don't have the best connection today, so I was attempting to go in on the chat. Yeah, there's just some specific areas around the county itself that have had a little bit more of a scope being placed on them recently, more specifically within the city of Kalamazoo itself. There have been a number of air quality tests that have been going on that have been they're trying to correlate that with some asthma rates in some of the neighborhoods that are near the industrial facilities in the area. And so it has been interesting to see some of that data come out. So I think it would be nice to see a little bit more of a detailed scope on being able to see specific areas around that city, I suppose.
Yeah, I mean, good point. If you play around with the maps, like, so if you know the area well, and I don't, I mean, you could probably look at the map and identify where the spots are. So I'm just opening Kalamazoo, and you can start to hone in on the places that you know those facilities are and start. The other thing you could do is look, you might have that in the city health dashboard and be able to find, the risk for lead, the lead risk in housing, thinking about asthma too. So you might be able to find those vulnerable populations too, and just, again, at the census tract level, map those things together. An EJ screen. Yeah, thanks, Aaron. Ann, sorry, I looked at Ann and I said Aaron. Yeah. So that's a good resource too.
Thank you. Yeah, it'll be interesting to take a deeper look at that at another time.
And the other thing, Macy, if you can, so that's actually a good segue. We're running a little bit low on time, but a good segue into those that want to play with the data. Make sure to go back to that link. Sorry. Let me show you real quick what data are available to you, and then we will wrap it up. So back into the places sharing. As you go to the data for current release and you click on the download, and you can do county comparisons in here too. It'll take you out to the location where you can download either county level data, census tract level data, place level data, right, for census designated places. And in these links, they're typically either Excel files or other CSV files, but you can also get the GIS friendly formatted files and play with them yourself. So you can do your own mapping. So that might be a useful tool for you. So yeah, thanks for that question. It does take some time, especially the places site to get into it. So in summary, sorry, this I'd be happy to take additional feedback, but I think we're gonna close up with just a summary that these tools, we're gonna, obviously we can share all the links. The links have been posted in the chat. The health data do exist, even at the smallest kind of places, literally in the places data set and website. You can play with those data a little bit, set up your own maps, because again, that site is not as user-friendly and as aesthetically pleasing as the others. Those data are useful because you are required in that community need and community engagement section to provide some of these measures. Specifically, the asthma and cancer rates are accessible in the places data set. Downloadable data, definitely encourage you to use that. There's a helpful resource, again, that has been shared. I'm sure we'll share it further. That's the Community Health Assessment one-pager. That'll largely, we'll focus next time on, again, working on community health assessments, some work we've done in the past, which health agencies are required to do those, who you can work with on those, and these data are usually plugged into those health assessments. So with that, I think it's time, Paige, for another poll. The first question, are you still here? No, I'm just kidding. Just some information to help assess how we did today. 5 quick questions before I turn it back over to my friends.
Christian, we have one question in the chat from Emily.
Okay. While people are filling out the poll, I'll look at that.
And thank you for your information.
Good question, Emily. Yeah.
So my response was that the local public health agency will have better information about how that national data can be applied. And there might even be an epidemiologist who can give you a whole lot of additional information that wouldn't be reflected. But I defer to the doctor.
That's you, is it not?
You're the presenting doctor.
Only my mom calls me doctor. The local, yes, in many instances, the local health department will have these data. And again, I'll talk a little bit more about what agencies, and instead of me typing all this out, what agencies are required to conduct health needs assessments, but largely, Emily, they use these national and usually county health rankings if they're looking at a county level, and then presenting those to the community to use in a prioritization. Like, this is the most, what is the most pressing health issue that needs to be taken care of and how, or the community health needs assessment and implementation planning. Sometimes they will add on community surveys to it, especially larger health departments that want to target vulnerable populations in particular. So.
Okay, that makes sense.
Yeah, and we'll talk about that in the next one too, and talk through some experience we've had with some folks here at WVU doing hospital health needs assessments in collaboration with the health department. So it's different all over the country. Yeah. Yeah. So it looks like the post poll is finishing up. I will turn it back over to Katie, I believe.
Thanks, Christian. I know we internally have been looking forward to today's webinar. We've been very excited about Christian and the content he was going to provide. So we really appreciate you all taking the time to join us today. And want to let you know that he's going to be back next month for part 2. So if you enjoyed this, tell your friends, please come back and join us in April. It's April 13th, also at 12 noon. You can go ahead and register on the link. I believe Becca also provided it at the beginning within our chat. And so there you're going to learn how your town can use this information that you learned today to put that toward redevelopment plans and grant applications through the EPA. We also want to let you know about upcoming conferences. In June, the Virginia Brownfield Conference will be held in Danville, Virginia. So if you haven't already, please consider joining us there and booking your room. We're happy to provide you with any information. You can also find that information on our website. I know that's actually going to be through the Northern Brownfields Assistance Center website. We can provide that information. And then the West Virginia Brownfield Conference is actually going to be held in Wheeling at Ogilvie Park. It's going to be a great venue, and that is in September. Currently, we are still taking calls for sessions. So if you have any ideas, that's open until next week on the 31st. So again, we'd love to hear any session ideas you have, or again, please consider joining us. Next slide, please. All right, so we just wanted to provide you with our contact information. The man of the hour, Christian, whose information is provided on the left-hand side of your screen. And then you have the contact information for Carrie, our director, myself, and then Becca. She's the one who keeps us organized and on task for all these webinars. And so she can also provide you with any information and help get the word out and send you any content or information that would be helpful if you need to help get the word out to any of your groups. So also want to point out, if you ever have any questions, general question, doesn't matter the topic, you can always schedule a one-on-one consultation, and the link there on the bottom right-hand side will give you the opportunity to do so. We really do hope you enjoyed our session today. We do enjoy putting these together. So if you have any questions, please let us know. And again, we definitely look forward to seeing you in April. Thanks again, Christian.
Thanks everybody for your time and attention. I know it may have been overwhelming, tough to do on Zoom, but please reach out to us, to me. Happy to help out. I love this stuff. So yeah.